watching Eyewitness News in high definition.
There's a live look over the Santiago Canyon area. You see lots of thick black smoke there, and with the winds shifting, all that smoke that was sent over the Pacific by the Santa Ana winds, well, it's all going to be coming right back on shore in the next couple of days. Very important to know the actions you take now can protect your future health of your family.
Researchers gathered valuable information following the Southern California fires of 2003, and what they learned can apply to us now. And health specialist Denise Dodor joins us to explain.
Yeah, the big problem, all the smoke. During times like this, doctors are most concerned about those with respiratory conditions like asthma, allergies, and other types of lung disease. But following the wildfires of 2003, researchers found it wasn't necessarily the people with breathing problems who had the most issues with the smoke. On this date 4 years ago, hot and dry Santa Ana winds encouraged the spread of fires through 6 Southern California counties. Dense plumes of smoke dominated the skies for several days. Data compiled through the USC Children's Health Study found wildfire smoke increased eye and respiratory symptoms, over-the-counter medication use, and doctor visits. Homes who reported the smell of smoke indoors for at least 6 days reported a rise in sleep disturbance and wheezing. Asthma attacks increased 63%, but researchers say the health effects were not restricted to kids with asthma. Scientists say non-asthmatic kids saw a substantial increase in wheezing, cough, doctor visits, and missed school. The reason? More kids with asthma took better precautions. They used masks, spent less time outdoors, and ran their air conditioners and air cleaners when indoors. Doctors say healthy kids are the least likely to protect themselves.
Kids are typically more active. They take in more air during activity than we grown-ups do, and they tend to ignore their symptoms for longer.
Occupational studies on firefighters show ash and debris floating in the air is small enough to become lodged in the bronchial tubes and air sacs. Cardiothoracic surgeons say anything that inhibits the flow of oxygen can cause erratic symptoms.
Chest pain, shortness of breath, again, fatigue, anything that would be consistent with a heart attack could also be mimicked by smoke inhalation.
Dr. James McPherson says now is not the time to stop taking your heart medications. Call to get new prescriptions if you've had to leave your home. Researchers say what we've learned from other wildfires can help us get through this one unscathed. Again, proven strategies that can help you in the weeks to come include wearing an N95 rated mask, staying indoors, and running the air conditioner. Today, emergency room physicians from Centinela Freeman Hospital in Inglewood are reporting a 20% increase in the number of respiratory patient cases. While information gathered in the aftermath of 9/11 might help Southern California firefighters, a study presented to the American College of Chest Physicians found that steroids helped in treating firefighters who worked during 9/11. The inhaled steroids seem to reduce long-term lung damage. Some firefighters in the study used steroid inhalers daily for 4 weeks following the collapse of the Twin Towers. Those who did had better lung function and a faster recovery from respiratory symptoms than those who didn't. So timely advice for firefighters. They need to take care of their health out there.
Exactly. And even if you don't smell the smoke, there is still some gunk out there.
Yeah.
Denise, thanks. For a look at what's coming up next on Eyewitness News at 5, here's Mark Brown.
Okay.